Hi, and welcome to the Life After 50 show. It's what you need to know for the second half of your journey. I'm Katherine Watson, and I'll be your host today. And I am here. I'm really excited. We are sponsored today by FindHoustonSeniorCare.com. Find Houston Senior Care is a web directory for the greater Houston area, connecting you to elder law attorneys, assisted living facilities, home care, home health, hospice, and so much more. We have over 500 articles, podcasts, and videos on the website to help you learn what you need to navigate this elder care industry. Each week, I bring different experts on to try to help you with areas that you may need to know more about. And today, I've got a really interesting guest, and I have learned some new things. It's really fun when I learn something new too. Today, I'm going to be bringing on Dr. Adrienne Bridges. She's a board-certified geriatric pharmacist, and I bet a lot of you didn't even know that existed. She's got over 13 years of professional experience, including long-term care consulting, corporate, clinical, and retail. Dr. Bridges specializes in evaluating drug therapy regimens for appropriateness, effectiveness, omissions in care, safety, and cost effectiveness. As a corporate clinical pharmacist, Dr. Bridges helped pilot a medication therapy management program in Texas. And we are so lucky that she took time out of her busy schedule to come and be on the program today. Dr. Bridges says the loss of an elderly loved one due to a medication error reinforced the importance of a pharmacist-guided clinical medication review. As a result, she formed her company, XL Consultant Pharmacist Services, a boutique consulting firm helping long-term care facilities in Texas meet and exceed clinical and regulatory standards. Dr. Bridges is dedicated to promoting patient safety and advocating for optimal therapeutic outcomes for geriatric patients. And I'm really happy to welcome her. Let's bring her back up here into the studio. And there she is. Hi, Dr. Bridges.
Hi.
Thank you so much for being here.
Thank you for having me today.
Great. So we're going to talk about something, and I have been learning so much, and I'm sure I'm going to learn more as the show goes on. Please, before we get started, if you have any questions or comments, put them down below on the Facebook page in the question and comment section. We'll try to answer any questions you have. If for some reason we don't get to your question during the broadcast, we'll be glad to answer it later, okay? So I'll make sure that Dr. Bridges gets those questions. All right, so first off, just what is medication therapy management services?
Medication therapy management services, they're a group of clinical activities that are designed to help optimize drug therapy. And Centers of Medicare Services actually requires that Medicare Part D providers incorporate these activities into their benefit structure.
Interesting. So Medicare does pay for it?
Yes, Medicare Part D does pay for medication therapy management services for eligible participants.
Okay, and what would qualify someone to be an eligible participant?
So each carrier gets to set their criteria, but it's going to be based on diagnosis, the number of prescriptions that are filled each month, and also anticipated cost. And so usually the diagnosis would include something like diabetes, hypertension, hypertension or high cholesterolism. Also, in terms of the medication count, usually about 8 prescriptions a month and an anticipated cost of about $3,900 a year. So generally for most plans, if you meet all of those criteria, you would be eligible for medication therapy management services. And if you're deemed eligible, you're automatically enrolled into the program.
Interesting. Okay. Now you say you're automatically enrolled in the program, but not unless you're in a facility, correct?
No, that's for all Medicare Part D recipients. Anyone who has Medicare Part D and is eligible based on the carrier's criteria, they would be automatically enrolled.
And I would say the majority of our seniors, unfortunately, are taking a number of medications like that and probably easily over the qualifying dollar amount in their medications. That's probably not going to be a big issue for most people.
That is correct.
So how would somebody get on those services?
Well, as I said, they're automatically enrolled, but most people just don't know that they're enrolled in the program. So one of the easiest ways to determine eligibility, well, there are two ways. The easiest way would just be to contact your local pharmacist, determine if they provide medication therapy management services. If they do, they can check eligibility for you. If not, you can contact Medicare Part D directly and ask if you meet the eligibility criteria. And I just learned last week that some of the carriers actually have call centers or support centers where they provide the services for some of their members over the telephone.
Oh, wow. That's interesting. Okay. So they would just be able to look at all of the records and help make recommendations and all, right?
Yes. Yes.
Okay. All right. So who performs these services? Do you have to be a geriatric pharmacist like you are?
You do not. The CMS says that it has to be a qualified person. And so I'm a little biased because I'm a pharmacist. I think the pharmacist is the best person to provide these services because I don't think any other clinician will be able to provide the information and the insight that the pharmacist can provide. So a pharmacist is a good resource to do that. I have a board certification in geriatric pharmacy practice. And I also think that is something that you should potentially look for because that certification is additional credentialing because when you care for elderly people, they do have specialized needs. And so there are certain things that have to be taken into consideration for that population that you wouldn't necessarily consider in other drug therapy management situations.
Okay. So can you give me a for instance in that? What would be something that I would consider?
So as we age, there are changes that occur in our body naturally. So there's a decrease in kidney function, there's a decrease in liver function, there's even a slowing of the GI tract. And all of those things together can actually cause medications to stay in the body longer than they should and or cause unwanted effects. And so there are a number of medications that should not be used in older adults. Some of them have special precautions, and if they are used, this is what you should do. And sometimes that specialization in the skills gives you a little more insight into the clinical picture of the individual patient, because all of these services, you have guidelines and you have criteria, but you really want someone who can look at the guidelines, look at the therapy, and look at the patient's specific needs and help make informed decisions.
Mm-hmm. I know too, when people are aging, especially, like a lot of women, and I guess some men too, may become much smaller and frail. I know my mother and my mother-in-law lost a lot of weight, and they were tiny little ladies. 85, 90 pounds. The medication that's given to them, I think sometimes the doctors don't take into consideration the dosage. Is that something that a pharmacist would key into, especially a geriatric pharmacist?
Absolutely. Some of the things that I listed in terms of like kidney function or renal function, that can affect dosing. Mm-hmm. And so sometimes when I do reviews, especially in the facilities, I will have to look at the kidney clearance and then determine if this medication is dosed appropriately for this person's kidney function at their age. And so that's absolutely something that a pharmacist should look for and can identify.
Mm-hmm. So you go into facilities, to long-term care facilities. Tell us a little bit more about how that works and what families need to know about that process.
Okay, I primarily go into skilled nursing facilities, And Centers of Medicare Services actually requires that a consultant pharmacist go into a facility every 30 days, once a month, and perform a clinical and regulatory review of pharmacy services. And so what that means is there are regulations in place that dictate the way medications are stored, the way they're administered, to policies and procedures to decrease the risk of medication errors. And so I go in and I do a review of those regulations in the facility to see how compliant are they, and are there areas that where they need to improve, and then I help them improve in those areas. But I also do a clinical review of each resident's chart, and so I look at the medications, I look at the behavioral notes, diagnostic information, laboratories, values, and I then generate recommendations based on the clinical information available, and I submit to the prescribers. And so that's something that happens every month. So if you have a loved one that's in a skilled nursing facility, a pharmacist is coming in once a month and they're looking over all of their medications.
That's good to know. And could a family actually meet with that pharmacist to find out or to express any concerns that they have?
Absolutely. You could put a request in with the facility administrator to speak with or meet with the consultant pharmacist. One of the things that facilities are required to do is to perform care planning meetings. And that's something where the patient and the family member can come in. That would be a great moment or opportunity if a family member would like to speak to a pharmacist, to invite that pharmacist into a care plan meeting, because they would already have the recommendations that they've made. And that way it could be a face-to-face dialogue to communicate the concerns of the family and or the resident.
Great. You know, Dr. Bridges, we have heard a lot lately about the opioid problem and how it's also affecting our seniors. Are you seeing any of this? And tell us your thoughts on this condition, this problem.
Well, we do see it. I actually saw something recently that raised the concern for another medication that has similar effects, not in the opioid family, and it's used quite often in the geriatric population. And so it is definitely a concern. It's one of the things that I review when I go into the facilities, because one of the quality of life measures that facilities are obligated to provide is pain management. And so that is one of the things that I review, the appropriateness of the dose, the appropriateness of the duration. Is a scheduled medication going to be better for this patient than as needed? How often are they using the as needed medications? Because if they're not using it, then perhaps it's something that you could cancel. And so that is definitely something that I look for when I go into the facilities. And then in addition to that, you have hospice care, and that's a whole nother situation in terms of how they dose and prescribe medications to help manage pain.
Mm-hmm. So do you, if somebody is on hospice care, would you still be providing the services, or does hospice kind of take over from there?
Well, I still perform the review and I send the recommendations to the facility. Oftentimes the facility will send the recommendations over to the hospice team, but those patients, just like geriatric patients have specialized needs, the hospice patients generally have a specialized need as well. So it's a little different.
Yeah. And then you've got the numbers of people that have Alzheimer's or some other type of dementia. And boy, it's a real balancing act. Do I give them more medication? Do I give them something for this anxiety? Do I give them something, what do you do? And I know for myself, when we were going through this with my mother-in-law, that was really a big concern, because you don't want to drug them to where they're not able to communicate or really participate in life. But at the same time, you don't want them off the wall with anxiety and struggling. What would you say to families of that, and how could your services be of help to them?
Dementia care and what they call psychotropic medications is one of the main things that the state looks for when they go into facilities. And it is of high importance and concern, because what what I, as a pharmacist, try to prevent, and the state try to prevent, is to ensure that if psychotropic medications are being used, it's truly warranted and it's not being used in a way where it is a chemical restraint, because that would go against the regulations. So I would encourage family members. One thing I did this year was I completed the OASIS Dementia Care Training with Health and Human Services. It's a phenomenal training seminar. And one of the things that I learned in that session was that when you have behaviors associated with dementia, try to change the way we think about the behaviors, because oftentimes what we see as a behavior is an attempt for that person to communicate. And so the whole idea is to, instead of try to medicate a behavior, determine what's trying to be communicated, and then implement activities instead of medications first, and add the medications after activities have been tried and they have been unsuccessful. Because a lot of these medications are considered inappropriate. So as you said, for anxiety, anxiolytics are considered inappropriate for elderly adults, and because they increase the risk of falls. They can also increase the risk of cognitive decline.
Exactly. It's like a double-edged sword, you know. What do you do? Yeah, it's really a challenge.
And then you have the other medications, the antipsychotics, that are often used, but those medications have what's called a black box warning. So the FDA has basically given it the strictest warning they can give, and it's known to increase the risk of death in elderly patients with dementia. So if it is used, it should not be used lightly, and you want to make sure that the diagnoses are appropriate and documented. You want to make sure that the behaviors are documented, that the activities that were in place to try to address the behavior is documented. And if all of those things are documented and it meets the criteria, then provide those medications. But even then, you still have to do every so many, well, depending on the medication, you have to do what's called a gradual dose reduction. So over a period of time, a pharmacist, a psychiatrist still has to review the patient's status to say, okay, maybe we can decrease this dose for, to the point of taking the patient off of it. So that's a very, very good question. Very good question. And you absolutely want to engage the pharmacist.
Yeah, it's a real concern to families. It really is. I speak with families all the time, and that's one of the biggest concerns, because we don't, like I said, we don't want to drug our parents, but yet at the same time, some of the behavioral issues get pretty bad. And it's really hard. I had a lady I talked to recently, and her dad had ripped the TV off the wall, and it was a big flat screen TV, and threw it at the caregiver. And needless to say, the caregiver quit, and it wasn't the first caregiver to quit on them. So she was having a real challenge because she didn't want any medication at all, but she was realizing that maybe she did need some medication for him. Something had to change. So it's a real challenge. I know one of the challenges too in our large facilities is there just aren't enough caregivers to really provide the engagement that is necessary.
One of the things that I've learned too, because even to your point of the person that you spoke with recently, we also need caregivers, clinicians, pharmacists who are actually trained in dementia care, because there are so many things that we as the family members or as the clinicians, tools that we can use to help our loved ones or our patients or residents who are navigating through dementia or Alzheimer's. And so it's just having those specialized skills to better address. And that's one thing I always go to all trainings. Any training that I can get to, I go, because in addition to that, the information does change. So what was considered a standard of practice, 2-3 years ago, it may be different today. And so just having the information and the training can better equip us to care for our elderly population.
I agree so much. And I think I think families, especially, a lot of families are just animate about wanting to keep their parents at home or their loved one at home, their spouse at home, and they want to take care of them themselves. They feel like they're supposed to do that. But the truth is they have never been given any training and they don't know how to do that. And so without that piece, it's going to be a struggle for them. And it's going to be a struggle for the person that they're caring for, most likely. So I think it's really important that everybody find a way. And I know the Alzheimer's Association puts on tons of training for families. They can, find lots of resources there. Let's see, what else did I need to ask you about the services? We talked about the eligibility. Do you ever work with home health care companies? Would that be, I would think that would just be a good fit, a good match.
That's actually something that I would love to do because I see the value of having that pharmacist guided review in different care settings, because a lot of times some of the drug errors or problems you see happen in a transition care. So when a patient is coming home from the hospital or coming home from a assisted living facility or a skilled nursing facility. And so to have a pharmacist as a part of that home care team, I think would be instrumental in preventing some of the actual hospitalizations that we see, because that pharmacist could definitely add value to the care of the patient at home.
I think so too. So any home health care companies out there listening, pay attention. You might want to reach out to this lady and talk to her. I just think that is a missing piece that probably needs to be addressed and hopefully will be at some point. So what else do we need to tell people about your services and how they can benefit from them?
Well, I encourage everyone to engage the pharmacist because we as pharmacists are such a resource of information, and we often have a different type of time frame to engage, one-on-one engagement. And these medication therapy management services are all one-on-one exchanges. And so one of them, the complete medication regimen review, is 15 to 30 minutes, where it's a consultation where you sit down with the pharmacist, we go over all of the medications, side effects, things that you should know, identify any potential concerns, and then we send that off to the prescriber. And so I would just encourage loved ones, patients to engage the pharmacist, because sometimes there can be gaps in care that the pharmacist can help identify and prevent additional complications.
So they can just reach out to their regular pharmacist where they get their medications.
I jokingly say I don't get my prescriptions filled at a pharmacy where the pharmacist doesn't know my name. So I would start with your local pharmacy first, because you should have a relationship. But a lot of people in today's culture, they use mail-order pharmacies. And so they might not have that relationship with a pharmacist, but you can definitely find consultants like myself. The American Society of Consultant Pharmacists has just launched a campaign, Help Manage My Meds.org, so it can help consumers identify pharmacists close to them who may be.
Say that again, helpmanagemymeds.org?
Yes.
Okay. Right.
And they can identify pharmacists, senior care pharmacists in their area who could potentially help with some of their additional needs.
I'm going to put this up here. And I put Adrienne's web address up here, meds.org. Okay. Well, for some reason it didn't work. I'll put it in the comments later for everybody that's watching. I'll add that link in the comments because I think that's an important link as well. We have got just a few minutes left. I really thank you for coming on here. One thing I would like to mention too, talking about your local pharmacy, a lot of people will bounce from one pharmacist to the next and all of this stuff to get a cheaper price. And I understand the need for watching your dollars. But at the same time, I think it's really important to try to have your medications in one place with one pharmacist. I've always been a huge believer of that. Because a lot of times the pharmacist can catch mistakes before you take that medication, and they'll know you. They know kind of what's going on with you because they see you on a regular basis. Like you said, they know your name. They know who you are. You're not just a number to them, and they'll be able to really help you make good choices. And if the doctor has given you a new prescription and it's something that might cause a problem with something else that you're on, they're going to key into that. They're going to know, and they're going to alert you and alert the doctor so that you don't have a bad experience, a bad medication experience. None
Absolutely.
of us want that. That's not fun.
No. And I was in the stores for 8 years, and I could tell you so many stories of how I was able to identify things or catch things for some of my patients.
Absolutely. It happens all the time. People don't realize. So it's just like, it's that extra set of eyes on the situation, that extra person. And they, like you said, they do tend to have more time to consult with you and to talk to you about your concerns with the different medications. And they're knowledgeable of what they're talking about. That's what they do. Medication is what they do. So I would definitely talk to your pharmacist. Anything else, last words before we close out the show today?
I would just like to encourage everyone to take advantage of the benefit. If Medicare will pay for it, utilize it, because it can really be beneficial in your long-term health and even meeting your personal health goals. So I would just encourage everyone that if you have Medicare Part D, find out your eligibility status and take advantage of that benefit, because it is a tremendous resource.
Okay, great. Thank you again for showing up on the show. I'm going to go ahead and bring you back down to the lobby.
Thank you.
All right. And I accidentally cut her off as she was saying thank you. I apologize for that. Thanks, everybody, for coming here and watching the Life After 50 show. Again, if you have any questions or comments about the show, we'd love to hear them. We'd love to try and answer any questions you may have. And whether you listen live or you're listening to the replay, we're here for you. If you have people that you would like to hear from, if you have a particular speaker, or you have somebody that you know that would be great to be on the show, please reach out to us at Find Houston Senior Care so that we can get them on the show to teach you what you need to know. Life After 50, it's what you need to know. I'm Catherine Watson. Again, this show was sponsored by FindHoustonSeniorCare.com, your local resource for everything elder care in Houston, Texas, and all the surrounding areas. Thanks for coming on, and have a great day.